Dzięki.
Else I can get you.
Hi.
Good morning, everyone.
Good morning.
Hi.
I apologize. I was stepping to these last conversations. I didn't realize that I had to jump into our webinar.
You have an echo when you speak?
I don't know what that
Hello, everybody.
I hear it now as well.
Hey.
Hello.
I'm going to jump back on.
Okay.
Thanks, Ashley. Ashley, I'm going to okay.
Thank you. So Anna, Holly and I will be your technical moderators, so we'll have our screens off and just assist you with any technical things, screen share, and we'll make all of our presenters co-hosts as well, just to let you know that.
Thanks.
You're welcome.
Hello, do I have an echo? I'm not sure, maybe it was not.
I don't think you do. You sound pretty good.
Okay, good, thanks.
There is an echo. Hi, everyone. I think
Hi.
that there is an echo when several microphones are on. So if several people are unmuted, there is an echo. That's why only.
Oh, I think it's okay. Hi. Hello.
Hey.
Hello. So I'll just give everyone a quick rundown while we're here. So I believe, who is our session chair for this one?
Pawel Pietrasienski, I guess.
Oh yes, Pawel is. Okay, so he's
Yeah.
also still in the other meeting. Okay, so
Yeah.
pretty much he'll be kind of guiding all of this, but myself and Ashley and another woman named Michelle will join us. She's in the back end, if any of you were in the first webinar. So we'll all three kind of be your back end support. If there's any technical issues, if anyone wants to do a practice share of their slides, you're welcome to right now. So far, luckily, we hadn't had any issues with that. We're going to be in the back end kind of maintaining. We have this set up so that participants can't unmute themselves while everyone's presenting. And then at the end, if there's time for a Q&A, which I know we're trying to incorporate, we'll go ahead and unmute it so that participants can just kind of jump in and ask questions. They can also ask in the chat, which again, I think Pawel will be monitoring, but we'll be keeping an eye on in the back end as well. And you'll see in the chat feature, you can always send a private message to myself, Ashley, or Michelle. And if you guys have any questions or any tech issues or anything comes up during the meeting, we're just here the whole time to kind of just offer support.
Okay, thank you.
Thank you.
I don't know if Eva
Thank you.
is
That'll be
with
great.
us.
Yes, yes, I am.
Ah, okay, you are.
I try to join the
Upload?
presentation.
Yeah, maybe you try to share the screen and they will say if it how it will be possible to see it, or if it will be possible. I have to switch off this subtitles because they make a lot of mistake and I am confused setting subtitles.
There's
Why
some
this?
problem. I can't
You can share.
exactly.
Don't worry.
I have the settings set up, so you should be able to.
Yes, probably. That's
Anya, maybe I will send you the presentation, the final version, and you
Okay.
will present it, okay?
okay.
Are they not showing up on your computer, or is it not giving you that option in Zoom?
Probably something doesn't work with Zoom, my computer, because I try to change the settings special for Zoom, but it doesn't work at this moment.
Okay.
Holly, I'm wondering if we need to make our presenters co-hosts, and I think because you are the host, you have that capability to do that.
Yeah, let's do that. That's a great idea.
And then I just checked it to where it's multiple participants can share simultaneously. So that should work as well.
Oh, perfect. That will work.
Is that visible?
Yep.
Okay, Marcin, już know.
Let me keep. I'm reading down our list, make sure I can get everyone as co-hosts. This will just give you the permissions to be able to unmute yourself where we have it so that participants can't, but you guys will be able to as co-hosts.
Okay.
And have you got the presentation?
No, I will check again.
Yeah, so yeah, I should say that we just wrapped up the opening session with the keynote, so you should see many more people coming in now, of course, including our session chair.
Yes, yeah, it looks like we're letting people
I
in
can
now.
see it.
On SGH mailbox.
Yeah, but I don't have it. Okay, I just make it again. No, still don't have it.
I have it as a sent message.
Maybe try with Gmail as well. Okay.
Okay.
Okay, so I don't know, if our technical. There you go. All right.
Oh, I'm sorry, I had a moment of troubles of unmuting, but now it's okay. So, do we have every participant right now? I see Anna. You are here. Is Anaka? You are there? Eva?
I am.
Yes. Marcin, Wajda? Yes, he is here. Okay, and
So
Elena.
here,
Hi,
Yes.
Martin. I didn't notice. Sorry.
Yes.
See you.
All right. We have everyone. It looks like it. So let me officially open this session.
Eva,
And
I don't have it.
I just sent it by Gmail.
Okay, yeah, I haven't SGH as well. Okay, so that's
Yes, it's okay.
Yeah.
Okay. So on Gmail you have the second version.
okay. So can we start right now? Okay. So welcome to the session number 5. This is COVID-19 and policy response. I am Pawel Pietrasienski. I am Director of International Trade at the Governor's Office of Economic Development. I am also the faculty member, Associate Professor of SGH Warsaw School of Economics. And because today, one important information, because today we have 5 different presentations. So please mind your time that instead of 15 minutes, you have around 12. So if you will be within 12, 13, I would say, that will be still time for us and for our participants to ask questions and for discussions. So for the participants, you can basically participate in the after Pawęta discussion. You can ask questions directly, or eventually also use in that case chat to ask your questions before. What is important about this session, we are going basically through the research on the marginal propensity to consume recessions, through basically the situation around healthcare industry in two different approaches in Poland and the United States. We have smart specializations in the European Union will be presented, and of course also the question about the problem about how born globals are affected on the COVID-19. So we have this COVID-19 as a major subject we are will be discussing today. So without further ado, I'd like to ask Anna Sokolova from the University of Nevada, Reno, Economics, to present your first presentations. Anna?
All right. Hi, everyone. Thanks for coming. And I'm very grateful for the opportunity to present my work. Can you hear me well? All right.
Yeah.
Okay, thanks. All right, so the paper I will present today will touch on the fiscal policy response in recessions. So as we all know, when countries are hit by bad economic shocks, governments typically will try to boost their economies through some sort of fiscal stimulus. So this is what happened in the US last year when the government adopted the CARES Act. And as a result, people throughout the US received pretty sizable checks from the government. But how much do these fiscal stimulus measures actually help the economies? Well, the answer to this question really depends on what people do with that money. So, for example, if they mostly consume the money, then when they receive the checks, what happens is consumption in the economy goes up. That stimulates aggregate demand, and then the economy is doing better. But then if people tend to mostly save these checks, then it doesn't really help the economy that much because, well, this kind of policy would not have a substantial effect on consumption and would not affect aggregate demand that much. So it really all boils down to, well, what is the share of the check that households are willing to consume, or what we macroeconomists call what is the marginal propensity to consume. Now, if you had macroeconomics classes before, then you would likely know that this marginal propensity to consume has a strong effect on fiscal multipliers, which measure how effective fiscal policy is in boosting GDP. And generally speaking, the higher the marginal propensity to consume, the higher the fiscal multipliers, and there is a pretty straightforward link there. So fiscal multipliers depend on marginal propensities to consume. But the other interesting thing about fiscal multipliers is, well, recent research shows that there is actually not a single unique fiscal multiplier that is stable for the economy throughout all the times. And in fact, we should really think of it as many fiscal multipliers that are different between times of booms and times of recessions. And so recent papers have shown that it seems that in recessions, fiscal multipliers actually tend to be much higher compared to the times of booms. So here is the pretty well-known paper by Auerbach and Gornichenko. And here's a quote from Jonathan Parker at MIT to that effect as well. But so why do fiscal multipliers depend on the business cycle? Well, one answer to this question could be it's because the MPCs depend on the business cycle. So it could be that the marginal propensities to consume are higher in recessions compared to normal times, and that is why we see these counter-cyclicalities in the fiscal multipliers. So that's precisely the question that I will try to answer for you today. I'll see if you're convinced. So my question is, so does marginal propensity to consume out of predictable or transitory changes in income, such as payment receipts through the CARES Act, for example, depend on the phase of the business cycle? Now, to address this question, I will use the technique of meta-analysis. Now, there are many studies out there that measure marginal propensities to consume, but typically what they would do is they would study just one episode, such as stimulus checks of 2001 or 2008, and measure it for that episode. So within that kind of study, you can't really tell whether the MPC is cyclical or not, because you only have, well, a short span of time characterized by one roughly unemployment rate. And so it's difficult to discern this, whether this counter-cyclicality is actually in existence. So what I do instead is I collect all estimates produced by the literature of the marginal propensities to consume from all of the published papers in the field. And then using those reported estimates, because they cover lots of many episodes with a lot of different unemployment rates, I'm actually able to study whether the reported MPCs are dependent on the unemployment rate that corresponds to the underlying data. So that's what I'm doing. And so in case I run out of time, the answer that I find so far, at least, is that, yeah, there does seem to be a pretty stable connection between MPCs and the unemployment rates. And specifically, it seems that an increase of 1 percentage point in the unemployment rate brings up the marginal propensity to consume by between roughly 3 to 6 percentage points. All right, let me tell you about my data. Okay, so first of all, what I do is I look at the published papers that use micro-level data from consumers that also have information about observable changes in income. So for example, there are very well-known papers studying the stimulus checks in the US from 2001 and 2008. And this, by the way, here is a paper by our colleague here at UNR. But aside from these studies, there are also studies that look at how consumers respond to similar kind of changes in income. So for example, regular tax rebates dividends from Alaska Permanent Fund, Social Security payments for those of government employees, pre-announced growth dividends in Singapore. And also more recently, there is now a lot of papers that have access to great data from online personal finance software. And so there they're able to look at how people just respond to regular payments such as salaries. So what they do is usually they look at how consumption responds to the receipt of the check and thus calculate the marginal propensities to consume. So altogether, I find so far 17 such papers that produce 654 estimates. So this sample is good in the sense that it's very homogeneous. But on the other hand, 17 papers means that there is not that many episodes of different unemployment rates, which is why what I do next is I will also look at a different strand of consumption literature that also studies the micro level data, but where people don't have this kind of natural experiment type settings. So they don't have data on observable changes in income, but they use instruments to predict changes in income. And this brings me up to 50 papers and roughly 1,200 estimates, which is much better for studying what I want to study, at least. All right, and let me briefly show some summary statistics. So the top panel shows you the data on the MPCs from the small homogeneous sample with observable income changes. And then the bottom panel shows the expanded sample. And you can see that the means here and here are pretty similar. And it seems to be that the marginal propensity to consume overall is about 21 percentage points. But also you can also see some preliminary data to the effect of what I was talking about earlier. So if I just limit this to episodes of high unemployment, then the MPC actually goes up to about 45%. But then when I look at low unemployment episodes, it goes down to 16. So there does seem to be some cyclical variation here. And so what I do next is I employ a more serious empirical strategy to study this. I'm now in a situation where I have these two samples and each of them has some benefits and drawbacks. So there is a trade-off. So what I decide to do is basically use both samples and compare the results. I think this is the best I can do given the constraints. All right, so here's my empirical strategy. So I take the estimate. So the left-hand side is the estimate I coming from a study J. And I regress these estimates first on the unemployment rate corresponding to the underlying data. And so what I'm interested in is this coefficient beta on the unemployment rate. But then aside from unemployment rate, there may also be other things that affect the estimates, which is why here I also add a bunch of controls that are meant to capture the study design. So various aspects of study design. So specifically, so I code in a lot of controls just because, the strategies that people use very widely in this literature, and especially that's true for the less homogeneous sample. So I introduced controls, for example, for data characteristics, such as the payment size, what kind of data, the year, and the frequency of the data, and so on. Some details about how likely the underlying sample should be liquidity constrained. Details about utility function, details about what kind of consumption measure are they using, what kind of income measure are they using, what specification do they use, which technique. And finally, I also code in, because this is estimates coming from published papers, so I also code in the characteristics of those papers. So for example, the journal impact factor, citations, and so on. All right, so here are my results. Now, the problem is that because I have a lot of controls, I don't necessarily know which subset of those many controls belongs to the data generating process. So the true data generating process for the MPC estimates. In other words, I have a problem of model uncertainty. So I don't know which combination of controls is correct, so to speak. Which is why, aside from the regular OLS, I also use methods that are meant to address this kind of model uncertainty, specifically Bayesian model averaging and lasso. So today I will only show you results from Bayesian model averaging because, they have a nice visual representation that I like. All right, so here on the left-hand side, I have my controls. So this is for small sample only, which is why here there is not, there's a lot of controls, but not as many. What Bayesian model averaging does is basically it goes through all possible combinations of these variables. Each combination or a model, it assigns a metric that measures a model fit, and then it ranks the model based on this model fit. So here on the horizontal axis on the left, we have the most likely models that fit the data the best. And then on the right-hand side, the less likely. So the white color means that the control is not included in the model. So for example, here, cumulative change is not included in the model. Citations are not included in the model. Red color means that the variable is included with a negative sign. Blue color is included with a positive sign. So the important part is you can see that unemployment rate is at the very top, which means that according to Bayesian model averaging, it's very likely to belong to the true data generating process. And it's consistently included in all possible models with a positive sign, which means that it's likely that this variable is important. And aside from this, there are other things that are important here. So for example, the payment size, and it has a predictable sign. Consumption measure is very important too. But today I will not talk about those results, just focus on the unemployment rate. And so here, this shows the posterior density of the coefficient beta that I was showing you on the unemployment rate. So that's what I'm interested in. And this is where the 3 to 6 percentage point change result comes from. So you can see that the mean of the distribution is pretty close to 6. And overall, it's pretty far from 0. So you can see that, yeah, this estimate seems to be pretty precise. All right, and then I repeat the same exercise with my bigger sample that includes 50 papers, but that is less homogeneous. Now, because it's less homogeneous here, the problem of model uncertainty is going to be even more severe because there's going to be more control variables because many things are different across studies. So here you can see many more controls, but when we zoom in, the result is basically the same. The unemployment rate is shown to likely belong to all good models, and it's always included with a positive sign. So these results are pretty consistent. So the good thing about the sample again is that here I have more instances of different unemployment rates. So potentially these results could be maybe trusted a little bit more. The bad thing about the sample though is that the estimates within it are a little bit less comparable, and so I have to include many more controls. All right, so this is the same posterior density distribution for the coefficient on the unemployment rate for this bigger sample. You can see that here the effect again is stable and positive. It again is pretty far from 0. It's a little bit less pronounced compared to the previous case. So it's not close to 6, but more like close to 4. But it's still definitely economically meaningful. All right, I am now ready to wrap up. So as you can see, the key findings from this exercise so far is that, yeah, the unemployment rate does seem to have a strong effect on the marginal propensity to consume. Specifically, as the unemployment rate goes up by 1 percentage point, the MPC tends to rise by about 3 to 6 percentage points. And there is actually a good explanation for this in the theoretical literature on consumption. So for example, it could be that when countries hit recessions, more people lose their jobs, more people become liquidity constraints, and liquidity constraints become more binding for more people, which is why more people exhibit a stronger consumption response when they receive extra money. So that actually tracks pretty well with the existing consumption level theories. Now, the important implication of this is that, well, it follows that fiscal multipliers, or the effectiveness of fiscal policy, must be also counter-cyclical. So they must be higher in recessions compared to booms. So fiscal policy must be more effective in recessions. Now, I should tell you that what I presented today is preliminary results. And right now I'm in the process of expanding my small sample. So far, I've collected 15 new papers. So that brings me up to well, 17 plus 15, so 32 papers in the smaller, more homogeneous sample, because in recent years, there's been a lot of studies dedicated to precisely this question. And that also includes a paper or two from the CARES Act of last year. All right, that's all I have to say. Thank you for your time.
Thank you very much, Shana, and almost on time, a bit longer, but thank you for keeping this concise. And now I like to ask Anaka Aiyar is from the UNR Economics. So Anaka, the floor is yours.
Hi, can you see my screen?
Yes, we are seeing.
Okay, thank you. So thanks everyone for being here today. I'm an assistant professor of economics at the College of Business, and actually my research is on topics of health economics. And today I'll speak to you about one of my papers on India and looking at the effectiveness of health insurance on infant mortality. So just to give you some context, for those of you who are not following the news or haven't, well, probably already know that India is right now struggling with a rather uncontrollable second wave of the pandemic. And one of the things that experts are generally concerned about in India is that this overwhelming of the health system, how does it going to impact things like child immunizations, access to health services, essential health services for women, such as reproductive health services and so on. And the concern is that the lack of access to these services was going to have long-term impacts on children's health and human capital development in the country. So in this context, this research that I'm presenting to you provides you just maybe a little silver lining in all this on how a previously implemented health insurance program in India improved child health. And then we can have then I will conclude with some discussions on what the pandemic has taught us and how insurance might be able to help us in this context as well. So can you still see the full screen?
Yes.
Yes.
Thank you. Okay, so just to give everybody a little bit of context, so infant mortality has been falling across the world, which is good news, but not fast enough. And just by virtue of its population size and the demographic dividend in India, it is one of the largest contributors to infant deaths across the world. And in fact, within India, there's a lot of variation in these infant mortality rates, with some states in India actually doing far worse than countries in sub-Saharan Africa. So most of the deaths that we see from infant mortality are actually from preventable causes. Some of it is due to preterm complications faced by women, and an easy fix to that is access to antenatal care and postnatal care for women. Also, children die very commonly in India and the developing world from communicable diseases. And this can be fixed with immunizations, but it is often the case that we see utilization of services is generally very low. So one of the concerns that is majorly cited in the literature, but it is also true given my own personal experience when I was back in India, that is affordability is a larger concern with regards to access to healthcare. And this seems rather counterintuitive, even in a place like India, where the government actually tries to provide free healthcare services, maybe similarly to Poland. But people are still not able to access this care because they have to pay for other kinds of there are other kinds of costs that they face, which right from paying for medications to transport and so on. So, so for example, in this context, Indians spend up to 60 to 70% of the total health spending comes out of pocket. And that is a rather large amount, especially for those who are many people who are living in poverty or at close to the poverty line. Consequently, and no surprises then, what we see in India is that the utilization of formal health institutions is rather low. Again, depending on the level of development of the state, there are huge differences in, for example, women accessing birth facilities or conducting births in formal health facilities. Similarly, immunization rates in India are still pretty low. They're still at about 68%. There have been a lot of interventions that have been implemented in order to push families to get more immunizations, which are also free, but these have met with some success, but not enough. Now, in response to this problem of affordability, many developing countries across the world are implementing health insurance as a potential safety net to protect families not only against catastrophic health expenditure, but sort of give families that little extra push with regards to increasing affordability of quality health services. And hence India is no exception to that. Is no exception to that. And in general, the idea for health insurance and why we think it improves access to health services is essentially because of its mechanism through working through prices of health services. So the idea is that even when it comes to systems like India, where things are free, health insurance programs tend to provide the kinds of benefits such as access to private services that generally are not affordable to the poor. It also provides access, provides transportation costs and pays for a little bit of stay costs for families when you go to hospitals and so on. So through this both direct and indirect impact by increasing access to health services for children and for mothers, we expect to see that health insurance might actually play a role in improving child health. So the literature in this, the broader literature from other developing countries like China, Colombia, Costa Rica, Mexico, Nicaragua, Vietnam, Taiwan, Thailand, and actually shows that this is the case, that even in many contexts where health systems are provided for free, public health systems are free, that actually giving people health insurance first increases healthcare access. People are definitely more likely to go to doctors, but the sort of effects on child health, whether or not that can improve, have been mixed. In some countries that has been very successful. Taiwan and Thailand are examples of very successful programs of health insurance improving child health. But in China and Costa Rica, for example, Colombia, for example, the results are more mixed, with some groups benefiting more than others. And now there's also a lot of research slowly coming out, and this is the recent research, but in general, the field is developing to show that there are long-term productivity benefits from having insurance at a very young age, including better educational outcomes in the future, improved wages, and greater income mobility across different groups. So India's health insurance program was implemented in 2008, and it was just started in 2008, but it sort of got rolled out after 2011. It was a publicly funded health insurance program targeted to poor families, and just for 30,000 rupees, which is 430 USD, and I believe that's around 1,600 zloty, you could get access to comprehensive coverage for secondary and tertiary services. You could go to public and private hospitals, and households just paid a very small fraction, that's 43 cents, in order to receive this insurance. And reproductive health services, neonatal care services, family planning, and so on were also covered through this particular program. Now, in order to run our analysis, we have to use two data sources, which are our key data sources. The first is something called the National Family Health Survey. This is a freely available survey for researchers that covers multi-countries. It's called the Demographic Health Surveys for those of you working on health. And it has household surveys, and over 700,000 women were interviewed for this particular program. And it is representative at the district level, which is something like the county level in the United States. What these interviewers do is they ask women their retrospective birth history, asking them how many children were born, when they were born, what their health outcomes were, and so on. They also collect detailed information on access to health services for up to the last 3 pregnancies. And in addition to all these kind of interesting details, they have a number of SES, health, and anthropometric measures. Now, the administrative data on the RSBY that the insurance program is called the RSBY, is procured from a government website that provided enrollment data of the program. And we, in this study, my co-author and I use the date of implementation for each of the program in each district. Now, just to give you a sense of the variation, we see here that basically between 2012 and 2014, there's a huge increase in the number of districts that take this program up. So from virtually going to 0% implemented to we go to 66%, or 2/3 of the country received the program by the end of 2014. And in 2014, we have this nice situation where there are some districts that receive the program and some districts that don't. So we have a lot of within country variation in who receives the program and who doesn't. And consequently, we're going to put these two together and estimate a difference in difference. Now, in this difference in difference, what we're going to do is that we're going to compare the child level outcomes. So this is we're basically going to compare women, the outcomes of health for children born to women from 2010 and 2016. And we're going to compare children who are born within RSBY treatment districts and RSBY and districts that did not receive RSBY in their districts. In addition to things, our estimation strategy also controls the fact that compares children who were born before RSBY came to their districts and after RSBY was available in their districts. So we have this two-way fixed effects model, which is just a diff and diff as we know. And we also are able to include a host of controls at both at the child and the mother level that we think might determine both insurance access and child health outcomes and other outcomes that we're interested in studying. In addition to things, we also include household controls, district and cluster fixed effects, district fixed effects, month and year fixed effects, and our standard errors are clustered. So this is the general strategy. So basically the strategy compares children who are born before and after the program gets implemented in their district with also children who never received this program because for administrative reasons, the program was never rolled out in their district. The second strategy that we use is a typical event study. Here in the event study, we basically estimate the same effect that we have here, but we disaggregate it with respect to receiving RSBY in the sense that we basically compare, we basically set everybody who did not receive RSB or who did receive RSBY to a time 0 and then estimate how an additional year of exposure to RSBY then impacts children's health outcomes. So did the program improve child health? And the strong answer is yes. This is a very robust result that we find. So in this table here that we find that after controlling for all kinds of other programs, for accounting for all these kinds of district level and year fixed effects, that having access to the program reduced infant mortality rates by 1.81 over 1,000 children. And that, to give you a sense of how large that is, that's about a 5% reduction. And by the time the child reaches its second birthday, that's a 3.43 reduction out of 1,000, which is around a 10% reduction. In general, many experts who have studied this in developing countries have found that this is a 10 to 20% reduction. So a 5 to 10% reduction in that context seems low, but that's just the empirical strategy we use. If we remove, for example, all the districts that never received RSBY and just compare children who were to a similar cohort who within a district who received RSBY to a group that did not receive the program, then we find the effects are closer to that 10 to 20% range. So the results that we show are probably an underestimate of the true impact of the program, but we think that this is a realistic estimate of what happened in the country. Here is an event.
Just one more thing. You are approaching 15 minutes, so if you could start to sum up, would be great.
Wonderful. So let me then just scroll to the end. We have very robust results, and regardless of what we do to our empirical strategy, these results hold true. The only thing I want to add to that before I wrap up is that we find very strong evidence that this is driven by increased use of reproductive health services and child vaccination rates in the country. And we think that this is this is indicative of why we see a fall in the infant mortality rate and not the neonatal mortality rate. So let me conclude here by saying that we find evidence in favor of health insurance, especially during this pandemic where don't know access to health services has now become very difficult. We feel that this is a silver lining in terms of whether or not children and women continue to get access to health services. So let me end here and thank you for your time.
Thank you very much for a very engaging, excellent presentation. So right now I will ask Ewa Kosycarz from Szkoła Główna Handlowa Warsaw School of Economics. Ewa will say about organizational resilience in healthcare entities experienced from the pandemic periods. Ewa? please start. You have to unmute yourself.
Yes, okay. Thank you. Thank you very much for your presentation. But I would like to give the voice to my colleague, to Ania Krejner-Nowecka. She will start our presentation. She is co-author of our project. So please, Ania, continue to introduce.
Okay.
Could you click on the presentation mode, just because we are seeing this in the smaller version.
Ania, pokaz slajdów.
Yeah, I'll try to. Yeah, good.
Oh, perfect. Thank you.
Okay. So we are interested in the resilience in healthcare. So just a few words about the resilience, because the ability of organizations to respond to external threats such as COVID-19 is linked with the notion of resilience, but it is conceptualized differently across research streams. So we are oriented on organizational resilience, which have 3 different stages. First one, this is anticipation. Second one, coping, which are in our concern. And the third one is the ability to adapt to critical situations. And those 3 dimensions strongly depend on each other and always contain cognitive and behavioral capabilities. There are also contextual factors, for instance, resources or societal capital or power and responsibility, which are important to successful accomplishment of those 3 mentioned resilience stages. And generally in literature, we can find the voice that resilience is seen as a fundamental organizational ability that is directed toward organizational advancement. And also it's seen as a sustainable source of some sustainable competitive advantage. But the question is, we need more knowledge how organizational resilience works and how it can be developed. In general, we say that factors for building resilience in general, probably face of such a massive external uncertainty like COVID-19, is first that organizations need to develop adaptive business models. The second is that organizational or global supply chains should be resilient. And the third one is that resilience depends on the strength of employees. Moreover, not only probably employees, but also on decisive leadership. So you can see here different concepts, but in general, they have a lot of in common. And probably what is accented mostly is that the idea, what's the role of employee, what's the role of human capital, human resources within such a process. So to build organizational resilience, the vital elements probably, like in everything, it's time, money, but also resources, human resources. Why? Because they have some contextual benefits. That means information sharing came from people, resources exchange are connecting to people, to the employee, and also every kind of cross-sectional, cross-functional collaboration within the organization. What else? So we are thinking about social resources, and they result from specific interactions, and probably they might be achieved through supportive mental processes, which we observed during our research. So it's not only enough to have, let's say, qualified, good employee, good people. It's also important to have a proper management leadership. And now the idea of authentic leadership, it's very popular because in such a difficult time, people want to understand who to trust and where to find reassurance in such a current crisis in many organizations. Who will help them to make decision, who will just help them to find supportive well-being strategies. And the well-being strategies are very important when we talk about the healthcare organizations, because in general in big companies we many times talk about the well-being of the employee, of managers, but not in case of healthcare organizations.
Okay, so I would like to continue Anna's presentation. And as you already know, the organizational resilience covers many aspects of management. And in our study, which we would like to present you in this short presentation, we would like to focus on human capital, as Anya mentioned. And why? Because we share the opinion with the National Academic Press that without a skilled, motivated, and well-supported health workforce, no health system can achieve its goals. So this time, during the pandemic period, it is especially important. Now we would like to present you a few
part of our results.
Yes, parts of our results of our study. The study was devoted to organizational resilience in healthcare entities. We consider, of course, the whole cycle of resilient process, but our research focused on the middle stage coping, which is characterized by responding to current issues. Yes, so we check how healthcare personnel, healthcare professionals deal with very stressful environment during COVID breakout. How we check the resilience of the health worker. We conducted a cross-sectional online survey which was addressed to healthcare professionals. We addresses to all entities in Poland, in all of regions in Poland. Our study focused on the healthcare workers as an essential element of organizational resilience. Healthcare personnel consists not only from doctors, but all employed person and volunteers who have potential exposure to patient and or their infections material. So even workers from labs, yes, or emergency department, everywhere we ask people to answer to our question. We collected more than 500 answers. It was much more than we needed for statistical purpose to make any results, yes, conclusion from the study. Nowadays, we would like to present you a small piece because only 4 questions from our survey, which was directly focused on well-being of the personnel of the healthcare entities. The first question was, how often have they experienced anxiety due to lack of the adequate personal protective equipment? Because we have to remember that there was a huge problem with the availability of personal protective equipment when the pandemic broke out. So I think it was not only Poland, but everywhere in other countries too. So it was very important for us how they personnel deal with such shortage of materials. And we check it using the Likert scale. We started from 0 to 10, where 0 means never they have experienced anxiety, and 10 means continuously. We can observe that the results was rather critical. Yes, the people have problem, but we have to be sure that we have to admit that we expected more drastic result, that the people will, because when we talk with people in individual interviews, they supposed to be more frightened this situation. Oh, I have to add that the survey was conducted after the first wave of pandemic. Anya, could you change?
Yes.
The second question which we'd like to present you was, were you concerned that you might transmit the virus from your place of employment to your home and infect family members? And it was, for me, a bit surprised that the people, the workers who have contact with potential source of virus, they believe that they keep the family, maybe not everybody, yes, of course, but 182 persons believe that they feel that they keep their family safe. So it was very interesting for me observation. Anya, could you change? Thank you. The next question, which is very close to management of resilience in the entity, was how the management, how the managers deal with psychological problem of their staff. So we ask, to what extent did you feel psychological support during the COVID-19 pandemic from our employer? And in this question, the answer was really critical, because 420 persons assess that they rather don't feel psychological support. And in this context, maybe it isn't consist, but the next question, please, we ask maybe a bit wider. The question was, because during pandemic you received support from, please notice that this is support, the whole sort of supports. In previous question was only psychological support, and now we ask about support. So maybe we can imagine that there are think about other form of supports too. But the previous question, the previous answer was really critical. But in this question, we receive answers that 145 persons received support from the superiors, yes, but we have to point here that the most popular answer was that people relative to professionals, healthcare professionals, were the source of support for them. And similar observation we can find in articles, papers from other countries, where people close to workers, healthcare workers, are the main source of support. I would like to summarize our presentation and say that I think that the situation of the healthcare professionals is very painful because we have shortage of this kind of people in our healthcare system, and I think that we have to really care about them. So it's a bit stressful for me that they feel not supported during the pandemic period. we have noticed that nowadays, in the first quarter of this year, a lot of Polish doctors and nurses ask for special papers which allow them to work abroad. So I think they feel they exhausted. But I think this is our weaknesses of our system, the healthcare professionals. But on other way, we have some strengths. We have to note, we have to say that we didn't have the situation, the shortage of beds, the shortage of respiratory equipment or something like this. But the healthcare professionals are really, how to say?
Rare resource.
Yes. So if you're interested in this topic, I encourage you to follow us on ResearchGate on our project and read our articles which are in progress, because we ask almost 30 questions to our respondents. So we have really a lot of other interesting results. Thank you very much.
Thank you.
Thank you. Thank you very much, Eva Kosycarz from SGH and Anna Krejner-Nowecka. Sorry for my omission at the beginning. Also, Warsaw School of Economics. And now I like to ask Marcin Wajda from also SGH, Warsaw School of Economics, but also he's also involved with Masovian Marshall Office, and the paper was done together with Małgorzata Białczak, but I understand, Marcin, you are alone today.
Yes. Hello, everybody. Thank you very much for invited me. That's a great pleasure for me to be here with you. And before I start, I have one comment. I don't know why I am in session 5, COVID-19 and policy response, because I have the presentation about smart specialization in European Union, which is midterm strategic document. But I have the good news too, that I have very short presentation. So let's start. As Pawel mentioned, I represent Warsaw School of Economics and Marshall Office, which is regional government and one of the 16 regional governments in Poland. And so I present today our regional innovation strategy. As you can see, the first strategy was adopted in 2007. The validity period has been specified until 2015. The innovation strategy was not only thematically orientated, it focused mainly on the activities undertaken by the Marshall Office. Stakeholders' involvement took place only as part of social consultation and through the functioning of the consultative body, the Masovian Innovation Council. The update of the strategy adopted in 2015 introduced the areas of smart specialization and a framework for the process of entrepreneurial discovery, among others by establishing working group for smart specialization. For the purpose of implementing the strategy, significantly increased the importance of meetings and workshops with stakeholders. The regional innovation strategy of the Mazovia until 2030 is the third strategy document adopted at the Voivodeship level and devoted entirely to creating conditions for development of innovative activities. For June 2019 to September 2020, work was carried out on the REASE project on strategic consulting carried out in the second half of the 2019 and at the beginning of 2020. in which a series of strategic workshops with stakeholders were a key element. Stakeholders co-created the SWOT analysis, which include, for example, the pandemic consequences for economy, vision, main goals, strategic goals, activities, and proposal for monitoring indicators, as well as scenario for the development of our region, Mazovia Voivodeship. Changes for implementation regional innovation strategy in Mazovia, challenges for implementation. First, too many entities to take into account. We have over 800,000 companies, several dozen research institutes and universities, not clear industrial specialization in the voivodeship, not enough administration resources, too little social capital and trust among stakeholders, which is very important thing, and little interest of the largest entities in cooperation at the regional level. As part of the work on this RIS Mazovia 2020, 4 cross-sector area of smart specialization for the Mazowieckie Voivodeship have been identified. First, safety food, intelligent management systems, modern business services, and high quality of life. But the role of the smart specialization in the Mazowieckie Voivodeship was not limited only to this identification of the areas of specialization, but to prioritization of project applying for support from public funds. And I mean here public funds, Polish public funds, which are available, and European public funds from cohesion policy, which are available too. Smart specialization of Mazowieckie Voivodeship is open. What is important? It assumed the possibility of identifying new development niches at any time in the implementation of smart specialization strategy. Entrepreneurial discovery working groups on the smart specialization in the Mazowieckie Voivodeship. There is a bottom-up process involving entrepreneurs, research centers, universities, and other influence the innovation policy in Voivodeship. Main task of the working group are to provide ongoing support for risk management authority, to ensure compliance of smart specialization area with the needs of entrepreneurs, to identify niches for smart specialization, areas for experimentations and further development, for example, regional research priorities, to give the opinion on risk implementation document, like, for example, implementation program, rule of calls for projects, and to discuss support instruments aimed to solving specific problem in the areas of smart specialization. How it works, everything, that is, I think, important. First of all, no special conditions for joining and partnership and participation, we cooperate with anyone who can commit their time. Can join, and everybody can join anytime. 2 parallel works path, of course, the first real meetings, and what is especially important today, we use the internet like everybody, and consulting as much as is possible via the online meeting and online groups. Collective nature of the solutions, every voice counts, but each individual has to convince other members what is important. Ad hoc task teams to discuss some issue in more detail. Minimum level of moderation necessary to sustain the discussion without distributing in with the local government point of view. And last, what is the value added of this? First, informal contact during the meetings, exchange of ideas among stakeholders, constantly development, contact database, more business-oriented approach in regional strategic document, and last but not least, ideas for some branch-oriented analysis in scope of regional innovation strategy like photonics, space industry, agri-food sector, and packaging. So I hope so it was interesting for you. That was much more theoretical from regional development, and that is, as I said, that is the strategy which is implemented around the Europe in all regions. So that's not the answer on COVID, but of course we use the smart specialization. We use the results, impact of COVID. We use during the public consultation, and we take this, of course, information when we collect the information for our updating our specialization, smart specialization. Thank you very much.
Thank you. Thank you very much, Marcin, for your excellent presentations. And two comments. One would be that, of course, during the question and answers period, that would be a case probably involving COVID-19 with your processes you just started to answer, I would say, what's going on with smart specialization that time. But let me also say about this session, it's a special one because as I check the whole program, this is the only one which is not concurrent. So basically, this is the only one at the time. So every other is concurrent. So people has to divide, and sometimes it's very difficult even to choose which one, because sometimes or you know, all cases are those concurrent sessions are strong. And now last but not least, of course, Elena Pawęta, Szkoła Główna Handlowa Warsaw School of Economics, will tell us about born global entrepreneurs in the COVID-19 pandemic, determinants of rapid internationalization. So Elena, the floor is yours.
Thank you very much. Thank you. Do you hear me well? Great, thank you. So I'm very happy to be here, and it is a pleasure to listen to your presentations, to be a part of such an international gathering, international meeting. And this is actually what I'm going to speak about a little bit today, about those possibilities that we have now of connecting globally with people all around the world. So I will be speaking about born global entrepreneurs and how COVID pandemic influenced the behaviors of born global entrepreneurs. So first of all, to define what I'm going to speak about in my presentation, I was researching international entrepreneurship for some time, and because of the last year, actually in the middle of pandemic, my book was issued on born global entrepreneurs, and they are individual level determinants of their rapid internationalization. But I did not, because it was written before the pandemic, I did not take into consideration some of the aspects that pandemic brought into the area of international business. And that is why this presentation and this work is kind of addition to my previous work. So actually the international entrepreneurship did not, before 1990s, maybe all of the studies on international business, they were about big multinational corporations that were going international in stages, step by step. There were internationalization theories, stage theories, which showed how companies step by step go and conquer international markets. But then new studies showed that there are companies that become global immediately. New type of firms appeared, and in the literature they are called born globals, they are called international new ventures, They are called global startups. Very often you can see the term INV, International New Venture. So those are the companies that go global immediately. And it was possible due to technological progress, due to the opening of the borders before the pandemic, and higher speed of international communication, also increasing number of people with international experience, with entrepreneurship education and experience of international entrepreneurship. So all of those factors, they influenced this fact that born global companies emerged. And I started researching this phenomenon from the point of view of individual level determinants. So there are internal determinants that are for example, the type of the product company has, the type of the organizational model. There are external determinants and individual level. So I was looking at the entrepreneur and their behaviors. And here currently there is a certain gap because we know that COVID-19 pandemic influenced and disrupted the stage of international business quite significantly. And in this work, I try to see how and in which areas pandemic influenced born global entrepreneurs and will continue influence, of course, and in which directions. So the questions that were asked is, how did the companies, did born global companies react to the pandemic? And how in the future, how is it going to influence the speed of internationalization? And also, in what way can entrepreneurs use their skills, their knowledge, their approach, all of those determinants that I was researching before, in order to conduct business internationally during the pandemic? So those were the questions. And based on this model that I came up with before, and just a few words about this model is, here we can see the individual level determinants, so aspects that influence the fact that born global companies become global immediately from the inception. So we have here entrepreneur background aspects and market behavior aspects. The entrepreneur background is all of his experiences, knowledge, education, also innovation and technology orientation, and international networks, which are kind of the way to internationalization, because global entrepreneurs, they are very active in the international networks, different types of networks. And of course, we have aspects connected with market behavior. We have dynamic capabilities, entrepreneurial orientation, effectuation, logic. So this entrepreneurial type of thinking, which includes resilience that we were discussing during this panel, and agility, and those type of behaviors. And of course, this leads to rapid internationalization. But how the pandemic situation disrupted and can influence those behaviors. So I conducted literature review on the articles that appeared in within the last year, and I must say that I was really happy to see that a lot of researchers all around the world, they are also researching and discussing this topic, because it is still an ongoing thing. So we cannot state anything now for sure. We are in the middle of the pandemic, but we can already see different trends that are happening, and we can discuss how those trends will influence international business. So additionally, I was looking at the 7 case studies of the born global companies from different countries. And using the questionnaire, I got very interesting answers and input on the topics that I was looking at. So I will also share a couple of quotes from these questionnaires in my presentation. So let's have a look at these factors that impact international entrepreneurship and born global entrepreneurs within the COVID-19 pandemic. So first of all, one of the major factors that is influencing international business in general now is the reshaping of the global supply chain. And we can see that the changes are really big in different countries. That, for example, the COVID pandemic in the beginning brought the healthcare crisis. There was a shortage of medical supplies in some countries. And for example, when Chinese factories got closed, where some of the items were produced, some of the items of basic needs, then some countries, they switched into prioritizing their own citizens before supplying to foreign customers. And some countries, they were just unable to adjust and to meet the domestic demand, and to increase their production. So all of those scenarios, it shows that the global supply chain, it will continue to reshape based on this experience, and it will include the relocation of some activities out of some production out of China, increase in a domestic production in the European Union, increase in domestic production in the US in some aspects. And what does it mean for born global, for born global companies? Well, it is, on one hand, it is more opportunities, because then they're able to meet the demand of those markets that need more, the demands of new markets that were maybe closed for them before. And those changes will definitely impact born global entrepreneurs, because the way how they do business, with whom they cooperate, which markets they operate in, for sure this will change. So some global ventures, they did not see any barriers before, and they were just active all around the world. Now maybe it will change a little bit, and they will be forced to limit their outreach, maybe to start focusing on neighboring countries, on certain regions. But for sure this will change. And here we can see that one of the born global entrepreneurs said that they had issues with availability of parts, and there were several answers like this that it influenced businesses a lot. So another trend is disruption of institutions and networks. And as I showed previously, networks, international networks, it is one of the big factors that is influencing born globals and their behaviors. The challenges are that the disruption of flow of ideas, resources, social capital. Also, there is evidence that the decline in flow of venture capital across borders, and this can be a problem, especially for emerging economies. And on the other hand, also there are some opportunities because many new initiatives appear, international initiatives, and networks, which would not be possible without the pandemic situation. And I'm speaking about different types of business support groups, huge international hackathons, online networking groups. Of course, again, it is changing, but there are challenges and opportunities as well in terms of international business. And born global entrepreneurs, they always say that their network of international contacts is very important for them. So then we have business digitalization, the next trend. We discussed it a little bit yesterday, also during one of the sessions. And so before COVID, business digitalization was taking place. And actually, when I started researching born global companies, and I was starting my interviews, talking with born global entrepreneurs, all of them were working on Skype. And there was the Zoom, and was not such a thing before. It was Skype. And it was unusual. It was something unusual that they had contacts all around the world. Now, a lot of people have access to this, have access to free tools, and however, not all the companies, they managed to adapt to this new normal. So some companies were struggling to adapt to this new digital challenges, and they were forced to limit their activities, but all
Yeah, something happened.
Yes, I can't hear Elena. She's frozen.
Yeah, the black screen.
Maybe she lost connection.
Okay. I don't see her.
Pawel, do you want to go to the like maybe questions?
Probably yes, probably yes. And we will wait, and because she still had, let me double check, but she still had. Oh, actually, that was her last minute. So that was, in fact, she should be able. There is something in the chat, but yeah, it's nothing there. So let me start the discussion, and I don't see anything in the chat, but if anyone has question to speakers, projects, except Elena, if someone could basically ask question or let us know about this.
It's like for many organizations, the future is less unknowable than it is unthinkable. And probably the question is that we know, but we don't think or try not to think about. So maybe the advice for the future and for the organizations is just not escape, just think about it, that it may happen. Or happen for sure.
So I think from the global policy perspective, when we're thinking about, food systems and how do we prevent pandemics coming from food systems due to zoonotic diseases, I think there's one thing that countries can do, which is prepare for food safety. So if you look at the emergence of most of the recent diseases, they've all come from the food systems with human-animal interaction. So Ebola came from there. The previous H1N1, SARS, all of them have come from the food systems. So I think in that light, I think countries investing in food safety and One Health is a potential thing that countries need to invest going forward.
Yeah, and I have to add that the one thing which is connected to what we are discussing is also with the last two papers, because that was about, let's say, institutions and networks, and by the way, about disruptions of them. So we are pretty lucky, and I understand that Elena is already back with us, but the question is more to the, also from the point of the more to the regional government, and it's this disruption also means that the institutions have to change, and also in case of the companies, those born global companies, we have to change the whole system of their support, as it was indicated that there is a problem with the kind of the internationalization of this venture capital movement. So the question probably for two last speakers.
Maybe could I add something? I think that we are quite prepared for such situation, pandemic, because we have a lot of international global organizations who monitor any problems with food, with animals disease, people disease. We have something like ECDC, in the USA is CDC. Yes, we have in Europe, we have special agencies for medication, and we had signals about the virus, but I think that a lot of people, a lot of governments ignore the signals. So because okay, something is in China, but it's far away from us. Yes, and we were not enough. How to say, we didn't listen to the signals. I think it is the problem. And the second problem is the lack of solidarity between among people, among nations. So I think it could be the reason how we can improve our preparation to such situation.
May I ask the question?
Yes, please.
Yeah.
Yes.
You finished, yes? So, okay. Yeah. Hi. I have a question to Marcin Wajda about the program you were talking about, the program of the program directed especially and realized in the Masovian region. And my question is, what is the stage of the, let's say, of the realization of this program? Whether maybe I haven't noticed, but maybe it was in your presentation. But generally, but I don't generally when it started and how long it's going to to be realized to go. And another question is about the effectiveness of this program. So I am aware that there are the special goals to be achieved in this program or in this special project. But how the question whether the effectiveness of this project were already studied or evaluated or researched by some researchers or the representatives of the deciders, I don't know. And if not, how it will be, how the effectiveness of this program is going to be evaluated or assessed, because how to measure, let's say, the effects of the public money allocated for this, because it's very general to make the region the business. Oh my God, how did you define this? Yes.
Okay, I understand. Okay.
Hi.
The regional innovation strategy was updated in this year. And it is a midterm strategy to 2030. So 10 years midterm strategy, which show us the path to goals which we have in our region. And the goals, of course, are quantified with the strategy. We know the goals. And the value of the goals we taken from the public statistic office. So after the 10 years, we make the evaluation, ex post evaluation, and we check that we achieve or not these goals, which we assume in the regional innovation strategy. So I don't know the methodology which will be used for that. So don't ask me about that. I have no idea today what kind of methodology they use to check this.
And the name of this project is?
Regional Innovation Strategy.
Regional Innovation Strategy.
Midterm strategy. Yeah. And I would like to ask one thing to the discussion about pandemic. I think that this of the pandemic was unpredictable. That is that is war, and it was unpredictable from that's my opinion. But what is important from economic point of view, development point of view, is to find this critical point to launch the public programs to come back as soon as is possible on growth path. So today we must focus and find this point where it will be possibility to launch public programs which can support the SMEs, which can support the R&D sectors, and come back to growth path. Because that is I think that is the most important for public administration now. And another case, important too in Poland, but around Europe, is to come back to expenditure level for R&D, which was before the crisis, how to come back to this level as soon as is possible. That is the question, yeah? Because we know that the expenditure for R&D going down, and the question is how help the R&D sector to come back on this level, which was before the pandemic. So thank you very much.
Thank you, Marcin. Thank you for answering my question.
Pawel, if I may, I know like we're almost at the end, but kind of like in response to Marcin's question, and also tying to Anna's presentation. So like obviously this one was like very sudden, like everybody expects that, oh, there's going to be a recession at some point and I may be unemployed, I may the government's basically thinking that, well, like, yeah, we got to do something, if the business cycle changes and the recession hits. But then you're hit with the pandemic, and we had a few weeks ago, maybe months, I had a lecture on tax policy, and one point that was made by the lecturer was that the governments, they usually, they also fail sometimes, but they do an okay job with the risk, but they do not do a good job with the uncertainty. So there are like many government programs that handle the risk, but then the uncertainty, such as being hit with the pandemic, right? They're not very well prepared. So kind of like tie into, I guess, the Anna's presentation is that these big events that are very uncertain, very unexpected, probably affect the behavior, the psyche. Now, I don't think that you can do much about this, Anna, because like, I guess people are writing papers right now about that, right? But like, what would the MPC effect on the MPC on such things such as unemployment? What would be that effect in response to like, risky events, like, things that we expect, but we don't know for sure, such as a recession, as opposed to completely unexpected events, such as the pandemic, I guess.
I think thanks for the question. That's a deep one. Well, I think it depends on what kind of effect are we talking about. Is it ex ante before the event happens, or is it ex post after, right? So if it's ex ante, we know that events such as this are possible, especially now that we have updated our expectations after the pandemic. Then I guess MPC would be generally lower in normal times because of people are risk averse, so they will factor into the account the possibility of such events happening in the future. So from the perspective of the kind of buffer stock saving models, you would then have to save a little bit more today for precautionary reasons. But then in terms of the response after the effect, so after the shock hits, that I would say is not clear in terms of what happens to the MPC. I'd say that if the shock is really devastating, then generally your regular macro model would predict that the MPC would be higher, because that would, a really devastating event would leave more people unemployed, more people caught unawares, more people liquidity constrained, which then would have an effect on MPC, and so they would have a stronger response to receiving extra payments from the government, I think. But yeah, overall, it's a good thing to think about.
Yeah, and we have probably to start to sum it up, because now would be a short break and next session will be coming. But that was an honor to chair such a session, very engaging discussion. So that's always good to keep the time at bay, because those discussions also bring extra value. And interesting situation, I just noticed that we had two Annas, yes, presenting today. So that's from statistic point of view, and really probably and of course some technical problems prevented from Elena to give us the summary, but I already remember this declining flow of venture capital movement through international borders is definitely worth to meet again and discuss it, because that's the also the thing for I would say for future policies to support also internationalizations, or Polish or American born global. So that's one thing. And important information session. So we will have two concurrent sessions starting at Nevada time 11 a.m., Polish time 8 p.m. 20. So one is on session 6 would be chaired by Agnieszka Domańska, and session 7 will be chaired from the UNR. Yes, will take over this session and chairing, and I look forward to it. So don't go away. But right now we have to probably divide on both sessions. Mehmet, did I miss anything?
No, that session is chaired by Jim Sundali from the Department of Management in our college.
Perfect. Mm-hmm. All right, so thank you again, and we will be meeting in 20.
Thank
So
you.
in a moment. Okay.
Thank you.
Take care.
Thank you.
Thanks. Bye.
Bye.